Can meditation truly change how glaucoma patients experience life? For many, the answer is not as straightforward as one might think. Glaucoma, the world's leading cause of irreversible blindness, affects millions of adults over 50, and yet, its silent progression means that countless cases go undiagnosed until it's too late. But what if a centuries-old practice like meditation could help improve not only mental health but overall quality of life for those living with this chronic condition? That's where this study begins to challenge established ideas about treatment and care. Introduction. Glaucoma is not just an eye disease, it's a lifelong burden that slowly erodes vision by damaging the optic nerve and destroying retinal ganglion cells. Often associated with increased intraocular pressure, it causes permanent vision loss. In 2020 alone, nearly 8 million adults over 50 experienced vision impairment or blindness due to glaucoma. Despite these staggering numbers, the true global impact is likely higher since symptoms often remain hidden until advanced stages. Beyond physical vision loss, glaucoma takes a significant emotional toll. Patients frequently experience depression, anxiety, disrupted sleep, and mood disturbances. Studies show that anywhere from 7% to 57% of glaucoma patients experience depression, and 12% to 49% live with anxiety. Those with visual impairment are nearly twice as likely to report depression. These emotional struggles are shaped by factors like age, disease stage, and treatment history. Researchers have found that newly diagnosed patients, particularly in India, reported a noticeable drop in quality of life within months of starting treatment. This isn't just due to medical factors. The constant stress of hospital visits, fear of blindness, and dependence on lifelong medication all contribute to emotional strain. Even daily activities can become daunting. About a quarter of glaucoma patients voluntarily quit driving, while others avoid nighttime or bad weather driving. Yet, they still face higher accident risks compared to non-patients. Reading becomes slower, recognizing faces becomes harder, deeply altering social interactions and independence. Meditation and its potential impact. Meditation, a practice centered on mindful awareness of one's thoughts and sensations without judgment, may offer a way to reclaim mental balance. By interrupting negative thought cycles, such as worry, fear, or rumination, meditation helps individuals manage stress and emotional challenges. Research has shown its benefits across various populations, improving symptoms of depression, anxiety, and chronic stress. Intriguingly, studies involving glaucoma patients suggest that meditation does more than improve mood. Some trials have shown significant reductions in intraocular pressure, a core concern in glaucoma management. Others have noted improved quality of life and better overall well-being. Given the growing comfort older adults now have with digital technology, an online meditation program may serve as an accessible mental health tool for this population. But here's where it gets controversial. While meditation's benefits are promising, its effectiveness in virtual formats, especially among older glaucoma patients, remains largely untested. That gap is exactly what this study aims to explore. Study design and objectives. This 12-week randomized controlled trial, RCT, seeks to determine whether an online meditation program can feasibly enhance quality of life and mental health among glaucoma patients aged 75 and older. Participants will be randomly assigned, 2 per group, to either a meditation intervention or a usual care group. Those in the treatment group will receive 2 online training sessions, 60 minutes each, led by certified instructors from Prasanna Wellness. They'll then participate in weekly virtual group meditation sessions, supplemented by at-home practice. The control group will continue receiving their standard glaucoma care. Data will be securely gathered through REDCap, an encrypted online system. Identifiable information will be kept separate from clinical data, ensuring full confidentiality. Inclusion and exclusion criteria. Participants must be 75 or older, diagnosed with glaucoma, fluent in English, capable of providing informed consent, and able to use a computer independently. They must also be physically able to sit through a 30 to 35-minute meditation and willing to practice daily at home. Exclusion criteria include inability to consent, severe medical instability, substance abuse within the past 3 months, or participation in similar meditation studies. Anyone with irreversible vision loss that prevents questionnaire completion will also be excluded. Assessments and questionnaires. To evaluate mental health and daily functioning, participants will complete several standardized instruments. SF-12, short-form survey assesses physical and mental health across 8 domains, producing physical and mental component scores. HADSA, Hospital Anxiety and Depression Scale. Anxiety measures anxiety symptoms and provides a clinical benchmark. Scores greater than or equal to 8 suggest anxiety. CESD, Center for Epidemiologic Studies Depression Scale screens for depressive symptoms in the past week across emotional and behavioral domains. PSQI, Pittsburgh Sleep Quality Index evaluates sleep quality over the past month. In addition to these psychological measures, feasibility benchmarks such as recruitment rates, adherence, and data completeness will help determine whether a larger future trial is justified. Ethical oversight and research integrity. This study strictly follows the Declaration of Helsinki and is approved by Western University's Health Science Research Ethics Board, SHREB ID 121484. All data will remain confidential, and ethical safeguards are in place to manage sensitive mental health information. Should any participant show high depression scores, CESD greater than or equal to 24, the principal investigator will refer them for mental health evaluation within 48 hours. Challenges and data management. While meditation has shown potential across diverse health conditions, the jump to a fully online model introduces new uncertainties. Will older adults adapt to the virtual setting? Will engagement and adherence remain high? To manage these risks, all researchers and assistants will receive comprehensive training on REDCap data handling, good clinical practice, GCP, and maintaining study fidelity. Data quality will be monitored weekly. Any anomalies will be flagged, corrected, and documented. Communication logs, REDCap assessments, and team meetings will ensure transparency throughout the study. Recruitment and implementation. Potential participants will be approached at the IVI Institute by ophthalmologists, who will verify eligibility based on age and glaucoma status. Once consented, participants will complete baseline questionnaires in person or online. Those randomized into the meditation group will attend 2 foundational virtual sessions followed by weekly 60-minute guided practices for 12 weeks. To encourage honest feedback and minimize attrition, participants will complete short satisfaction forms after each session. Those in the usual care group will have the opportunity to join the meditation program after study completion, at no cost, but without new data collection. Statistical analysis. Feasibility metrics, such as recruitment, retention, adherence, and data completeness, will be analyzed first. Then, repeated measures ANOVA will examine changes in quality of life, depression, anxiety, and sleep across both groups over time. With a target of 50 participants per group, the sample size is designed to ensure sufficiently reliable pilot data for future large-scale research. Safety considerations. The study team acknowledges potential emotional triggers tied to meditation, especially for participants with past trauma or mental health challenges. However, evidence shows that guided meditation is safe for older adults when properly supervised. Participants will be free to pause or skip sessions whenever needed, and any distress will be swiftly addressed by the clinical team. Confidentiality and data protection. All identifiable data will be encrypted and stored securely in the principal investigator's office. The dataset will remain available for up to 15 years after completion, after which it will be securely destroyed following hospital and Microsoft data handling protocols. Discussion and implications. Mounting evidence already points to the power of mindfulness in improving well-being among eye disease patients. Meditation and relaxation techniques have been linked to better brain oxygenation and improved optic disc perfusion. Some studies even show reduced intraocular pressure and enhanced visual performance. Still, skeptics question whether these physiological outcomes stem from genuine neurological changes or simply stress reduction. If further large-scale studies confirm these pilot findings, online meditation could represent a low-cost, scalable approach to improving both mental health and physical outcomes for glaucoma patients, potentially reshaping how clinicians approach chronic eye disease. But here's the question